Bill Gates, thank you very much for joining us on BBC Breakfast. I just wonder if I could first ask you, how important is it now to have a global response?
Well, I'd say it's critical because the tools that are going to reduce deaths, the drugs, that's a global thing to get those out. And the thing that'll get us back to the world that we had before coronavirus is the vaccine and getting that out to all 7 billion people. And so the efforts to test those, to build the factories, to understand, is it safe and ready to go? That's a global problem. So I'm glad, that people are coming together to find where is the best work and combine that. The factory will be in a different country than the science is in. This is the whole world working on probably the most urgent tool that's ever been needed.
Can I ask you to just reflect a little more on the way that world leaders thus far have responded to the crisis?
Well, there's the period when I and other health experts were saying that this is the greatest potential downfall the world faced, going back quite a ways with a speech in 2015 and a New England Journal of Medicine article about the specific thing. So, we definitely will look back and wish we had invested more so that we could quickly have all the diagnostics, drugs, and vaccines. We underinvested, which was my goal, was to get that to happen. We did do CEPI, which helped with some of the vaccine platforms, but not even 5% what we could have done. Then there's the period where the virus shows up in those first few months. What were the tests prepared? Did countries think through getting their ICU and ventilator capacity up? There'll be time for those postmortems. Very few countries are going to get an A grade for what that scrambling looked like. And now here we are. We didn't simulate this. We didn't practice. So both the health policies and economic policies, we find ourselves in uncharted territory.
I know one of the messages you're very keen to put out there is about that there should be more international cooperation. Can you try and give us a sense of what that you think should look like in practice?
Well, the coronavirus is going through waves. The first wave was very much China. And now there's a wave that almost all of the rich countries are experiencing very challenging epidemics. Hopefully by early summer, if the right type of isolation policies and testing policies have been implemented, a lot of the countries will be beyond the peak and looking at opening back up. Sadly, the developing countries, who as yet don't have a huge number of cases, are likely to have the worst of it because their ability to isolate, the capacity of their health system is far less than in the rich countries. And so the global cooperation is to help those countries and by helping them make sure the disease isn't spreading back to the other countries, and then to supercharge the therapeutics and vaccine work, which will involve expertise from all over the globe.
Do you think there's a very real risk then, as leaders of developed countries try and deal with the situation, the crisis in their own countries, that not enough thought will go to those places you mentioned before that at this stage possibly haven't been thought about enough?
Well, certainly, say we get a therapeutic that's partially effective, it'll be in short supply. What will the allocation be? Likewise for the vaccine. I do think that because the peak in the developing countries is coming later than in the rich countries, countries like, European countries, China, the US, we can take some of the, mask and ventilator and other things that have been ramped up and make sure that we keep making those things, but then they'll be needed. We'll have to ship those in developing countries. And we're seeing, China stepping up a bit in that way already.
When you talk about a therapeutic, you're talking about a vaccine, I'm assuming. Is that right?
No, I use therapeutic for treating somebody who's ill. So that would be like, you know, maybe, although the evidence is very, very weak, hydroxychloroquine, remdesivir. There's antivirals, antibodies, all sorts of things. The foundation created the Therapeutics Accelerator that's looking literally at thousands of things that you would give, that you treat somebody. That is only after you get sick. And of course, the vaccine is a protective to prevent you from getting sick.
Now, can I ask you, in relation to the vaccine, I know that you've donated a sum of money in relation to that. Just talk me through what do you think are the key elements around developing a successful vaccine? Is it money? Is it political will? What do you think are the key elements to that?
Well, we definitely need to fund the research and the manufacturing and the distribution. The distribution piece for developing countries will be Gavi, where the UK has always been super generous on that. The research will need to fund about the 10 most promising constructs, because we won't know in advance which one will prove to be safe and effective. And being effective for older people whose immune system is weak is a huge challenge. If you really amp up the vaccine to do that, then you can run into safety issues. So we're going to have to take something that usually takes 5 or 6 years and get it done in 18 months. There is an approach called an RNA vaccine that people like Moderna, CureVac, and several others have that looks quite promising, but we can't count on that. So we'll back, 4 or 5 of those and 4 or 5 companies using a more conventional approach, which unfortunately the schedule for that would probably not be as quick as if this RNA platform that we've been funding directly and through CEPI over the last decade.
You'll be aware a lot of people in the UK are asking what is a very simple and straightforward question, which is, when will there be a vaccine? How do you see that?
Well, it's a perfect question, because we want to get back to the life we had before coronavirus. And, people are seeing the economic destruction, the psychological stress. This is such an unprecedented, very tough thing to deal with. The people like myself and Tony Fauci are saying 18 months. If everything went perfectly, we could do slightly better than that. But there will be a trade-off. We'll have less safety testing than we typically would have. And so governments will have to decide, do they indemnify the companies and really say, let's go out with this when we just don't have the time to do what we normally do. So 18 months is about what we'd expect. We're doing everything we can. We'll write checks for those factories faster than governments can, and they'll come along. It definitely shouldn't be money limited. It should be, all the best constructs, full speed ahead, science limited.
As I understand it then, from what you're saying, is that it may be that there needs to be some compromise in some of the safety measures that would normally be expected to create a vaccine, because time is so crucial.
Well, of course, if you want to wait and see if a side effect shows up 2 years later, that takes 2 years. So whenever you're acting quickly, like during the HIV crisis, they created a quick way of getting drug approval. There is a trade-off there. In that case, it worked super, super well. And here, we will, I think, be able to get some safety indications, but this is a public good. And so, those trade-offs, the governments working on a cooperative basis will be involved in the decision to say, hey, the regulator says go ahead, even though you haven't taken the normal time period.
Do you think world leaders now are listening in a way they didn't out of necessity, bearing in mind, and I know you referenced it before, 2015 you gave one of those TED Talks, and if people go back and listen to it now, it was extraordinarily close to what is happening now. You were talking about the real risk of a pandemic across the world. Did you feel like you were listened to then? No.
The investments that could have been done so that diagnostics would have been essentially immediately available, drugs in less than half the time, the vaccine in less than half the time. Most of those investments were not made. Now, CEPI is the exception to that, but that's about 5% of what could have been done. Now we're scrambling, and it's taking us much longer to get these pieces together, even though scientists are doing heroic work. So, you know, unlike the defense budget that prepares us for wars, where we simulate the problem and we make sure we're good at it, this risk, which I viewed as even greater than the risk of war, there was very, very little preparation. Very few of these germ games where you try out and say, okay, how do you build up the ICU capacity? You know, can you make ventilators? How do you prioritize the diagnostics? That we're just figuring out as we go.
Do you think that, was that, do you think, partly a financial decision, that it wasn't deemed to be worth investing that money in something that maybe other people didn't see as clearly as you?
Well, it's got to be governments, because there's no private sector incentive for something that's uncertain like this. And even when it happens, you have to charge mostly a break-even price for things that are helping out with a global crisis like this. So, people still saw war as something to fund. In the less than 10% of that would have been needed for this, people just didn't organize their government to have that function. I do think now, because this has been so dramatic, we weren't ready for this pandemic, but I do think we will be ready for the next pandemic, and using the new tools of science, that's very, very doable.
Well, that really was my next question. I mean, given what you said in 2015, and you were very clear, people didn't listen. Are you optimistic that now, and obviously we need to get out of the immediate situation, but there will be a different mindset around the fears around viruses and pandemics?
Yeah, your speed of reaction is so crucial here, because it grows exponentially. If you're there 2 months earlier, which some countries jumped on this faster than others, they really were checking to see if there was community spread. They got the diagnostics capacity up quickly. But, we should be able to have diagnostics within a month. We should be able to have therapeutics in more like 4 months, and a vaccine less than a year, if we're on standby with the right factories and the right science. And we should have rehearsed how we deal with all these shortages, with working together. So a really good system for seeing this early and making sure we jump on it before the curve gets to a meaningful part of the population, that is achievable.
I know you reflected for a moment on this earlier on in the interview, and it is inevitable that here in the UK we ask our politicians questions about the way they've reacted, and to a degree it's inevitable that that thought process will be something that happens in the future that we look back on. I mean, can you sort of talk us through what you see from what's happened so far?
Well, a big missing piece is that funding the research for these type of vaccines. Actually our foundation is the biggest funder of vaccines for infectious disease. There could have been more. CEPI is the one thing that did happen there. And, now the next phase is, once we get the cases way down, how much can we open up? And that now there is an opportunity for governments to see what others are doing, to see which ones do run into a rebound of the disease, and really share these deep understandings. Like, are young people part of the infection chain? So I do think we will deal with this opening up phase in a more collaborative, data-driven way than the first scramble, where sadly, many governments were slow to react.
Can I just ask you finally, on a personal note, I mean, one of the things that we've all become very aware of is viruses know no boundaries, and everyone is affected. We are all human beings. And I just wonder, for you, yourself, looking at what's happening around the world, and also literally in a personal sense, with your friends and family, How has it been for you?
Well, I think everyone's life is completely disrupted. You know, your normal pattern of go to meetings, watch sports events. This thing, in my lifetime, this is the most dramatic thing. And, so now we're having to think through how do we rise to the occasion, get the scientists working together. I'm doing video meetings. I hardly see people at all. I ask myself every morning, did this really happen? And even though I worried about it, I still find it shocking how tough it is and how hard it's going to be to get back to the normal life that we had before.
On that note, and on that note of normal, do you think things will go back to normal, or is that all changed?
No, once you have a safe and effective vaccine and get that out to almost all of the people on the planet and build the preparatory systems for the next pandemic so you can nip it in the bud, we will go back to normal and economies will recover. But we have multiple stages to go through in terms of until we have that, how much can we open up? How do we help the developing countries? But the economy eventually will go back to where it was, and innovation will help us not be at such a risk in the years after that.
Bill Gates, very good to speak to you. Thank you very much for your time.
Thank you.
See the headlines as they happen and watch BBC News live in the app and get the full story with bbc.co.uk/news. Follow the story for all the latest with BBC News.
And last time we spoke on this show, you told me that in order to eventually be able to loosen the stay-at-home and social and physical distancing restrictions, the United States would need testing in place for, quote, knowing real time if a person is infected and then getting them out of circulation and contact tracing, unquote. When do you think the U.S. will have that capacity nationwide for that kind of testing?
Jake, we really can't guarantee every area of the country, but what we're told by the companies and the people who are getting the antibody test, which doesn't tell you if a person is infected, it tells you if they've been infected. And that's going to be important when you think about getting people back into the workplace. But the other point, which is important, if you start, and when one starts, to relax some of those restrictions, we know that there will be people who will be getting infected. I mean, that is just reality. The critical issue is to be able to, in real time, identify, isolate, and contact trace. That's called containment. Right now, in places like New Orleans and in New York City, we're in mitigation. You mentioned the governors. This is really important. I've spent this week on the phone with a considerable number of governors, some of which I believe are going to be on your program later on. They are really important. I'm deeply impressed about how much they care about the balance of preserving the health of their citizens in their state at the same time as they cautiously do this re-entry. So, I have confidence that with the help that we can do federally, from the federal government, to the fact that the states are really committed to doing it right, I think that combination, hopefully, is going to get us to where we want to be.
Based on what you know right now, when do you think the country will be ready to take some of these steps to reopen based on the availability of testing? When do you see that happening?
Jake, that's a great question. And that's really what I was inferring when I said a rolling reentry. It is not going to be a light switch that we say, okay, it is now June, July, or whatever, click, the light switch goes back on. It's going to be depending where you are in the country, the nature of the outbreak that you've already experienced, and the threat of an outbreak that you may not have experienced. So it's going to having to look at the situation in different parts of the country. Obviously, New York, who went and is going through a terrible ordeal, is going to be very different from Arkansas, and you'll hear from the governor shortly, and very different maybe from some places on the West Coast, like Washington State, which have been successfully able to prevent that big spike. I think it's going to have to be something that is not one size fits all.
When do you think it could start?
You know, I think it could probably start, at least in some ways, maybe next month. And again, Jake, it's so difficult to make those kinds of predictions because they always get thrown back at you if it doesn't happen. Not by you, but by any of a number of people. We are hoping that at the end of the month we could look around and say, okay, is there any element here that we can safely and cautiously start pulling back on? If so, do it. If not, then just continue to hunker down. And that's what, at least from the standpoint of the public health aspect, that we look at. Other decisions are going to have to be made at the level of the president and the governors about what they are going to do with all of the information they get. The only thing I and my colleagues in public health and medicine can do is to give a projection of the kinds of things that may or may not happen when you make these steps.
And I know you're concerned about the idea of what happens if it happens too quickly, prematurely, and then precipitously the U.S. or that area of the U.S. goes back to a dire situation. The University of Washington professor Chris Murray, who I know you're familiar with his work, he runs the model frequently cited by your task force. He told CNN that he is worried that if the country opens up too soon, quote, the risk of rebound is very great. And according to his model, when it comes to stay-at-home and social and physical distancing measures, quote, if we were to stop at the national level by May 1st, we are seeing a return to almost where we are now sometime in July. Do you agree with him? And what happens if parts of the country try to go back to some semblance of normal, but the testing and contact tracing capacity is not there?
Well, I mean, Chris is a very good modeler, and we relied on him heavily to give us some capability of making some projections. But I believe what they were referring to in that model, Jake, and it's important, is I agree. That's why I said a few moments ago, if you just say, okay, it's whatever, May 1st, click, turn the switch on. Obviously, if you do it in an all or none way, there's an extraordinary risk of there being a rebound. So in that respect, that model is correct. And that's why I mean it is not an all or none. It's going to be something that you gradually and carefully, in different parts of the country, in different ways, try to get back. I totally agree if that all of a sudden we decide, okay, it's May whatever, and we just turn the switch on, that could be a real problem. And everybody knows that. So it's going to be something different from that. It's going to be a concerted way to take a look and try doing it appropriately, depending upon where you are in the country and what the nature of the outbreak is in that part of the country. And I'm sure you'll hear the same thing from the governors.
South Korea and the U.S. announced their first confirmed coronavirus cases at virtually the same time in late January. If you take a look at where we are right now in the U.S. now has 50 times more cases and almost 100 times more fatalities than South Korea. Meanwhile, while the U.S. makes up only about 4.25% of the world's population, the U.S. has 30% of the world's reported coronavirus cases and almost 20% of the reported coronavirus deaths. Sanjay Gupta said this is all because we got started too late in the U.S. Is that right? Do you agree?
It isn't as simple as that, Jake. I'm sorry. I mean, to just say this is all happening because we got started too late. Obviously, if you look, could you have done something a little bit earlier? Would it have had an impact? Obviously. But where we are right now is the result of a number of factors. The size of the country, the heterogeneity of the country. I think it's a little bit unfair to compare us to South Korea, where they had an outbreak in Daegu and they had the capability of immediately, essentially, shutting it off completely in a way that we may not have been able to do in this country. So obviously, I would have been nice if we had a better head start, but I don't think you could say that we are where we are right now because of one factor. It's very complicated, Jake.
The New York Times reported yesterday that you and other top officials wanted to recommend social and physical distancing guidelines to President Trump as far back as the third week of February, but the administration didn't announce such guidelines to the American public until March 16th, almost a month later. Why?
You know, Jake, as I've said many times, we look at it from a pure health standpoint. We make a recommendation. Often the recommendation is taken. Sometimes it's not. But it is what it is. We are where we are right now.
Do you think lives could have been saved if social distancing, physical distancing, stay-at-home measures had started third week of February instead of mid-March?
You know, Jake, again, it's the what would have, what could have. It's very difficult to go back and say that. I mean, obviously, you could logically say that if you had a process that was ongoing and you started mitigation earlier, you could have saved lives. Obviously, no one is going to deny that. But what goes into those kinds of decisions is complicated. But you're right. I mean, obviously, if we had right from the very beginning shut everything down, it may have been a little bit different. But there was a lot of pushback about shutting things down back then.
Do you think it will be safe in November for voters to physically go to vote at the polls?
I hope so, Jake. I can't guarantee it. I believe that if we have a good, measured way of rolling into this steps towards normality, that we hope by the time we get to November, that we'll be able to do it in a way which is the standard way. However, and I don't want to be the pessimistic person, there is always a possibility as we get into next fall and the beginning of early winter, that we could see a rebound. And hopefully, what we've gone through now and the capability that we have for much, much better testing capability, much, much better surveillance capability, and the ability to respond with countermeasures, with drugs that work, that it will be an entirely different ballgame. So number one, I hope we don't have a rebound that would make this very difficult as we get into November. But if we do, and there certainly is a possibility, I'm a realist, it certainly is a possibility, hopefully we'll be able to respond to that rebound in a much more effective way than what we've seen now in January, February, March.